Hi guys, welcome to the program. I have a lot of public health news to deliver to you today, so I apologize in advance if this video is a little bit longer than usual, but we do have a lot of information to cram into one video. First and foremost, I will not discuss in this video what is coronavirus, what is the pathophysiology of coronavirus, how does it kill people, what is the autopsy result of the death victims. We've done all of that in the previous video, so if you're interested, please feel free to check those videos out. In this video, I want to address to you the public health news that has been going on in the past 2-3 days in the United States. As you know, several days ago, the World Health Organization has declared COVID-19 disease to be the worldwide pandemic, which I honestly think they're way behind the curveball, because a month ago, we knew that was going to be pandemic. So as of 2 days ago, President Trump has declared travel ban on the entire European Union continent, including the UK and Ireland, for 30 days. No entry of foreign nationals into the United States from that continent. And from early on in February, he has banned China from entering the United States. And that ban made a huge difference on the number of infected people that we have here in this country. So I want to talk to you about what is going to happen next in the next several weeks. What are the ramifications of the public health system, and how are we going to handle the cases we have here in the United States? So in the next 30 days would be absolutely crucial. It is crucial because are we going to be able to get this beast under control or not depends on two major factors. Number one, we have to absolutely stop the influx of infected people into this country, which is being done. Number two, the response that we will have for the people who are to be infected in this country, the mitigation of the infected cases in the United States. So if we're able to do both of that within the next 30 days, then we are going to be able to get this pandemic under control in the United States. However, the testing situation in the United States has been horrendous. And I'm saying that because as of several days ago, Iran was doing a better job we are. Even Vietnam was doing a better job than we are in the terms of testing. South Korea has been doing a much better job at testing. They are testing upwards of 10,000 people a day in South Korea. So we are nowhere near that. In the past several months, we only test a handful of thousands of people, and we're nowhere near we were supposed to be in order to do what we call blanket testing in epidemiology. So you have to blanket test the population to rule out the cases or rule in the cases so we can determine who has it, who doesn't have it, who need to be isolated and who does not need to be isolated. So that we haven't been there, and we haven't been doing a very good job of that. So hopefully in the next week or so, the CDC will roll out more testing, and it will take off. It's gonna take some time. It's not gonna go from 0 to 60 miles within 3 seconds, but it will take some time. You will have trouble finding those tests. You're gonna have difficulty to convince your doctor to get those tests. First of all, your doctors will not be able to tell you where to get the test because we don't have the blood tests in the clinics, okay? So the situation is very confusing. Where I practice, the only thing we have is oral pharyngeal swab, which is very dangerous because if somebody has COVID-19 disease, they take off the mask and you put a cotton ball in the nose or the throat and you swap around. What do you think the patient gonna do? They're gonna cough. And if they do have the disease and they cough, within 12 feet of that person, anybody around 12 feet radius will get infected. So we are not doing the oropharyngeal swab in the clinic. The most important thing is we have to be able to do the blood tests, and the blood tests are not available in the clinic. So the hospital where I work tell the patient to go to their doctors if they have symptoms of COVID-19, and yet we cannot test them in the clinic. We try to send them to the emergency room. The emergency room tells them to go to the health department. The health department then say, we don't test them here, go back to your PCP. The PCP will send them back to the urgent care. So that has been a tremendous coordination problem. And I do understand the frustration. It is every bit frustrating for the physicians and the providers as it is for the patients. We simply do not have enough tests in this country. And things better change, and they better change fast. Otherwise, we're going to lose the grip over this pandemic very soon. So that being said, the CDC is now in participation with LabCorp diagnostic tests, Quest diagnostic rather. They are going to roll out a massive amount of testing within the next several days to a week or so. So I do hope the situation improves, and we're going to keep an eye on that. Now, I do want to explain something very important. It is a very important principle in infectious disease and in epidemiology, and that is almost all pandemics that we know so far follow a very predictable pattern, mathematical pattern. So you talk about the SARS, you talk about the MERS, you talk about the swine flu, the Ebola, and even the Spanish flu back in 1918, they all follow a mathematical curve. So initially the cases could be very low and they remain low for a while. And then when the community spreading start, the cases will pick up rapidly. And as they pick up, they're gonna skyrocket. They skyrocket and they're gonna peak for some time and they're gonna go down. And that follows what we call a bell-shaped curve. A bell-shaped curve. So cases go up rapidly, peak, and then start to go down. So what we see in China now is that they reached the peak and now they start to go down. So the cases are going down in China. Several days ago, they only report 11 cases in 24 hours, which is literally unheard of because that is the epicenter of this COVID-19 disease. Now in Italy, in Iran, and in Europe, they don't have the same situation. They are currently in the exponential phase of that curve, and they're nowhere near peaking of that curve. South Korea started to see plateauing of the curve and a little bit going down as well because they're doing a much better job at testing people and quarantining people. So in the United States, that curve is coming. The question is, how are we going to blunt that curve instead of having a nice tall peak? We don't want that. We want a nice flat blunted curve so that we don't overwhelm the system and we are able to get this pandemic under control in the United States. And to do that, we have to be able to mitigate the existing cases in the US. So it is very important that the public understand we have to practice social distancing. So don't visit your loved ones in the hospital if you don't have to, if you can follow by the phone. Don't go to the nursing home and follow and visit your loved ones in the nursing home because you can bring the virus in there. Parties, gathering, and this is not the time to travel either internationally or nationally. Stay home. If you don't have to get out of your house, don't. So we know the schools are shutting down and we know that the workforces are shutting down and people are working from home, and that's a good thing. That's a good thing. The only way to stop the spread of this virus is that we isolate the virus and we don't allow them to spread from person to person to person. Now, if we look at all the country as a totality, the mortality is roughly about 1%. When it first started in China, the mortality was probably 3%, 2 to 3%, maybe 4, depending on which region of China you're looking at. But if we're looking at the mortality from South Korea, for example, it is about 0.3 to 0.4%. If you look at the mortality of other countries, it is less than 1%. Now you might ask, why is the mortality coming down when this virus is now become pandemic? And there might be an answer to that, as I did in one of my first videos back in January. We know that in virology, in the study of virus, as the virus is becoming easier to transmit, it's becoming transmissible easier. In doing so, it wants to survive because this virus wants to survive. And the only way that it survives is that it got to infect different hosts, one host to the next. And in doing so, it has to give up something. It has to become less virulent. This is why we're seeing the mortality coming down. Now, the same is not true for Italy. Italy mortality is now at 5 to 6%. And the reason why the mortality in Italy is becoming the highest in the world is, first of all, the public health system or the healthcare system in Italy is not able to handle this pandemic. They are completely overwhelmed. They are in big trouble right now. And the cases are exponentially exploding. And also, Italy did not take the situation serious months ago. They did not have the travel ban. People were entering the country and leaving the country as they please. And the quarantine and isolation of the patients that are infected with COVID-19 in Italy is not being taken seriously either. People are not self-quarantined. This is why you see an explosion of cases. Also, the pandemic in Italy happened in the midst of winter. It happened in February. That is where the highest cases of flu and cold viruses happened during that month. So the mortality significantly increased in that country because they are ill prepared and they did not have the type of travel ban that we have right here in the United States. Travel bans do work because we stop the influx of infected people. Now, let's go back to the bell-shaped curve distribution of a virus. We know that COVID-19 or the SARS-CoV-2 virus is 85 to 89% similar to the SARS virus of 2003. And that is done by DNA testing. We know by studying the DNA sequence, it is very similar to the SARS virus. Now, if you remember back in 2003, the SARS virus started in November in southern part of China and Hong Kong. And it lasted to July, summer of 2003. And it got contained and it got control. So if this SARS-CoV-2 virus is 85 to 89% similar to the SARS virus, it is actually good news. So we can use that model and we can predict with a certain degree of certainty, with some certainty, that it may act similar. So I predict, and hopefully I'm right, in the next 2 months, in May and in June, the cases worldwide should really start to go down because the SARS virus behaved in very similar fashion. So the ability to control the pandemic in the United States in the next 30 days is absolutely crucial. So I want to review some hygiene protocol with you. That is, besides staying home and practice isolation and practice social distancing, it is important that we try our best not to touch the face, the mouth, the eyes, and especially the nose, because the droplets is how you transmit the virus. It is important that you wash your hands frequently. So if you are touching surfaces, you're touching boxes, you're doing contact with anything that might be infected, it's important that you wash your hands for at least 20 seconds. And the way you wash your hands is obvious on the palms and also on the dorsal side of the hands, between the digits, but don't forget the fingernails and don't forget between the thumbs. That is where the thumb is the most important finger on the hand, and that is where the most contamination of bacteria and virus are located, in the palm of the hand. So gotta wash your hands with soap for 20 seconds. If you cough, pull up your shirt and cough inside your shirt or cough into your elbow. But the best way to cough is actually in a piece of tissue. And then you discard the tissue and then you wash your hands after, okay? So if you're sick, stay home. Don't go out, don't go to school, don't go to work, stay home. If you have to travel, cancel your plan. If you have to go to social gathering, don't do it, okay? So this is important times. We have to take desperate measure to stop the propagation or the spreading of this virus. So I have questions coming from the audience and also from the patients. How prepared are we with this pandemic in the United States? Honestly, we're not very prepared. We're not prepared in terms of testing, and we don't have the proactive measure in place. What we're doing now is reactive measure, okay? Now, in infectious disease, it is better that we overreact than underreact, because we're always behind the curveball if we don't overreact. So all the measures in place are good to follow, okay? Now, in terms of preparedness, in terms of material, we know several days ago that we have about, in the United States, 35 million masks in stocks. And those are for the usages by the healthcare professional. And of course, as you know, all the masks sold in pharmacy are completely gone. People are hoarding them by the hundreds and by the thousands. And there are price gouging online when you try to buy these. And it leaves the providers, it leaves the clinicians, the doctors and the nurses exposed to these risks, because we do have a shortage of masks in the clinics and in the hospital, okay? And that is very, very dangerous. Now, in terms of ventilators, the ventilators are used if the patient is intubated and they are hooked onto a ventilation machine. We in the United States have about 150,000 units in stock, and these can be replenished in the pipeline. But let's hope we don't need all of that. If we are able to mitigate and control this pandemic, if we are able to blunt that curve, we may not need that much ventilator machine. And also the mortality of this virus is also decreasing because it is desperate to survive. And that's a good news for us. That's a good news for us. Now, people also ask, where are we in terms of vaccine development? Now, according to Dr. Anthony Fauci, who is the director of the NIH Allergy and Infectious Disease Division, we should have the first trial on humans concerning the COVID-19 vaccine in less than 60 days. Also, where are we in the clinical trials of finding a treatment, a medication that can treat or cure or kill the coronavirus or the SARS-CoV-2 virus? And the answer is we don't have anything concrete right now. Everything is still in clinical trials. In the United States, we have been using remdesivir. Remdesivir is an antiviral that has quite promising results on the MERS virus. And that is being tested right now on the patient infected with COVID-19. Elsewhere in the world, in South Korea, for example, they are using chloroquine, quinidine, and high dose of zinc. And these medications are actually used as anti-malarial agents, and they do show some promising sign. In Japan, they are using high-dose antiretroviral agents to treat HIV infection, and it also shows some promising sign as well. In China, they're doing all of that. And they're using different medication, including the one used in rheumatoid arthritis. And it shows some results that are promising, but none of these treatments are a home run. None of them is ready to be declared an effective therapy. So the treatment for COVID-19 disease is still largely supportive care. Now, if you're interested in the modality of treatment and how to treat this, you can actually look at my COVID-19 autopsy report on a patient that was done at the Beijing Center for Disease Control. And I just want to spend a brief moment on panic, on the public fears and the public panic. And as you know now, toilet papers are completely sold out. So are the water, and if you're Asian, so are the bags of rice. They are completely sold out. And they're sold out because there is a massive pandemonium going on right now that people think is going to be the end of the world maybe in the next 24 hours. And this public fear is both predictable and irrational. So we saw this with Y2K. Remember in 2000 when we said the world was going to end? We saw this with SARS. We saw this with Ebola. We saw this with a swine flu. But the degree of fear has never been higher than before. So I tell people, you really don't have to stock up on supply for the whole year. You don't have to buy the water. You don't have to buy the toilet paper for 12 months or 2 years. There's a report now that there are some people in Tennessee, I believe, two brothers are hoarding 12,000 bottles of hand sanitizer and they're trying to price gouge online, try to resell it. So these activities should be illegal, should be criminal. So there's really no reason to do that. You don't have to hoard and you don't have to keep the supply for the entire year. When you do that, you're really harming the elderly people or the people who are bedbound or the people who are wheelchair bound and they don't have the luxury of driving to the grocery store, get in line and fight with you to get the supply. So I ask you, if you have those supply and you have ample supply, please share. Please help those in need. If you really don't have to have that much of supplies and that much of need, I ask you to help those who are now in need. I wish you all the best. I wish you the best of luck and health in the upcoming days. I will certainly report back to you if anything changed. Thank you very much for watching, and you can help the channel and support me in doing so by subscribing and hitting the bell button. And I will see you in the next video. Thank you very much and stay safe.